We have the ongoing natural history trial. Didn't want to turn this into a reading session, but you could talk to us about what we're doing in doing that trial. I think we've been working with other groups. Dan Murray has been collecting with other groups to send samples that they've already collected. So if their IRBs have approved collection of samples that they have stored, if they have the ability to send it to another lab, some of that's being done currently. So it has to be done within the context of a protocol for me. So I couldn't say I want to start collecting. I'd have to write a protocol to collect every 2 weeks. That information will come out of the protocol that will be finished next week.
From first gathering all the information, getting everything together, how long do you think that the time frame might be that this testing will be of value to prenatal screening? A year and a half, 2 years?
Prenatal screening, I think, is a complete part.
Oh, I'm sorry.
Yeah.
After
screening, I think
after birth.
if a commercial company, we're not commercial entities, if a commercial company picked this up, affiliate has expressed interest in it, it would be ongoing, the approved type of commercial test within the year standpoint. I'm not confident. There's going to be a window of time where, it looks good, and it will fall into this category of a screening test. That if it's positive, we've got to go do the gold standard.
Of course.
It's going to take longer for people to feel comfortable. If it's positive, and we've got NPC. That's going to come over a longer time period, a lot more patience. But the utility of the screening test would actually be of value because there's a reluctance on physicians to do a skin biopsy. Okay, they're easy. We do for medicine neurologists, we do it all the time. But your pediatrician is not going to. That first wave of tests, they're sending off a panel of tests that's blood-based. I don't know how many patients we've gotten in that had a large spleen. They got tested for NP, A, or B. Because it can go on a panel. Nobody has to think about it hugely. It can get sent. I know that's an antithesis to neurologists and geneticists, but sometimes making it easy on doctors so they can just send, I got this large spleen, just send this panel. Gets to the diagnosis a lot easier than having to get to somebody that actually has to engage the brain and think about it.
One more question.
I didn't see it. Okay.
I don't need that. How many patients do you think that actually have NPC that are not diagnosed?
You pick any number.
Yeah. Yes. Don't know. I mean, I think Marie has the best estimate, but I think a wild card is in the adult presentations. Psychiatric presentation, nobody has a feel for it.
Well, there was a study done in Germany, which is rather controversial, where there was a selected series of patients in psychiatric institutions, and the investigators found a 6% incidence of Niemann-Pick C, which none of us really believe, but I think we do all believe that it's underdiagnosed in adults. The oldest patient I personally diagnosed was 65, and she had symptoms for 25 years.
Oh my God.
So there's no question that the disease is missed. And Kenny makes a very good point that because you have to know the diagnosis and think of it and specifically do a skin biopsy and order the appropriate tests, it gets missed because a lot of people, fewer I think now than in the past, don't know about this diagnosis. There's so-called metabolic screening studies that people do using this new technology of tandem mass spectroscopy, which is what has allowed newborn screening to expand. So many states are screening for 50 diseases now. That sort of technology is what will be used for this oxysterol analysis. So that's why it's so valuable, because it means that people could this as part of a panel when you see a patient with psychiatric illness and rule out these diseases. As a neurologist, psychiatrist, even as a child neurologist, this is what it means, and psychiatrists ask us to do all of it. They don't know what they're looking for. They just want to say, rule out organic disease, whatever that means. What it means is they want us to think. We're happy to do that for them. And so there's a long list of metabolic and genetic diseases that can present as psychiatric illness. But that's I think, one big area where it's missing. The other one is atypical dementias in adults. Because not all dementia is Alzheimer's disease, nor is this, by the way, or frontotemporal dementia. There are many, many other disorders, genetic, metabolic diseases that can present in adults, but they can be difficult to diagnose as this diseases. So nobody has the answer to your question, but I think the answer is, the closest answer is there are undoubtedly a lot of patients, particularly adults, who get this. There are still some children who get this for a period of time, usually the diagnosis is made. Marie?
Just to comment further, and of course I fully agree with what you say. I think it depends very much on awareness. So we have to teach, and indeed in France now we have been trying to target very much the adult neurologists, and indeed in the past year we have diagnosed a lot of adult patients that should have been diagnosed a long time ago, including one 59-year-old lady. And also I think it depends very much in the countries. So some countries are better than others because the disease has been better known. But what is, I think, missed very much is the children who don't have any big spleen. And there are much more than we think of NPC cases that don't have obvious big spleen that can be palpated, and those usually the diagnosis is very much in our country, at least where, I mean, awareness is not bad among neuro pediatricians, but still those type of patients they will miss for many years.
Yeah, and I would reinforce that, Marie, because there is a misconception among some physicians that if you can't feel the liver or spleen, patients don't have this disease. That is absolutely wrong, particularly in adults. And we know from following patients over the years, in many cases, you can palpate the spleen in younger children, but as they grow older, it becomes impalpable. The other thing about the spleen is people worry about this as the clinical point. I want to give children spleen guards and everything. I've yet to find any report of anyone ever having problems with a ruptured spleen in this disease. It can happen in infectious mononucleosis where the spleen is very soft and can fall apart. In these storage diseases, it's really not a problem. So we have another question.
Well, at one point, I had a group home for mentally ill, and I found that the community at large, especially the medical community, tended to ignore their diseases, their illnesses, so I can see how the adult mentally ill would just go right through the cracks. I mean, it took me 2.5 years to get one of my clients diagnosed with cancer, which we all knew he had it.